Arthritis got you down? Well, this is Dr. Mark Petrapalli. I'm an orthopedic surgeon, and I actually treat more people without surgery than I do with surgery. And so when people come to see me, they usually want to know what arthritis is, and they want to know how they can, improve their pain without having surgery. So I always try to treat people without surgery first and explain to them what arthritis is. So arthritis is nothing more than the cartilage on the end of the bone. If you ever look at the white on the end of a chicken bone and look at that, that's called the articular cartilage. And that's kind of what we have on the end of all our bones. And our bones come together and form joints, and the cartilage on the end of the bone is kind of like the tread on a tire. When that wears down, that's what arthritis is, pure and simple. Now that does cause pain, and arthritis is one of the most common causes of pain in the world, and it's one of the most common things that I see. So we always try not to do surgery if possible. And I did a little Google search and came up with the top 3 non-operative treatments for arthritis pain. The number 1 was cortisone injections. Number 2 for non-operative was hyaluronic acid injections. And physical therapy was up there as well. And I would say that out of these top 3 things here, we don't really ever do cortisone shots. We do a lot more PRP and BMAC, which again, we'll do another video on at some point. The hyaluronic acid injections, we used to use them a lot more, but the insurance companies are not even approving those a lot of times nowadays. And there's plenty of studies that show that PRP works better than hyaluronic acid injections anyway. So we rarely use those either. And then the physical therapy, we do use physical therapy, and we have our own physical therapy department, but we also have something called VFit, Victory Fitness, which is a 1-hour total body fitness session. So it's not just concentrating on the knee, for example, it's concentrating on the entire body, and it's a full hour. And that is more of a medicalized fitness program that really treats the patient as a whole patient and not just as one body part. And we can talk more about that at some point in the future. I hope you learned that from those top 3 right there, 2 out of 3 we really don't use anymore. And as I talked about a little bit earlier in the video, what we do suggest and what we do use is PRP and BMAC a lot more. And we have videos linked down below to learn more about those.